Hey there, my name is Megan Clanahan. I'm the co-owner of Houston Moms. It's great to see you all today. And if you've watched a number of our videos, you will recognize this woman I have with me today. This is Dr. Traylor. She's the Chief Medical Officer for Next Level Urgent Care. Hey, Dr. Traylor, good to see you.
Howdy, Megan, and hi, Houston Moms Blog. I'm always so eager to talk to you guys about what's going on in the healthcare streets.
And you do such a fantastic job. And so we obviously love Next Level Urgent Care over here at Houston Moms, but also big personal fans. My family and myself have been for any numerous of reasons, but you guys continue to grow and expand, which is so exciting to see. So how many locations are we talking about in Houston now?
Well, my goodness gracious, in the Houston location alone, I think we're up to about 30. And then you've got another 14 outside of the Houston market. So we're up to 44 urgent care brick and mortar locations that anybody can walk in at any time between Houston, Austin, San Antonio, and Beaumont. We're in the Beaumont area also now.
That's great. I mean, it's been so fun to watch you guys continue to go, grow, and move. We also love the convenience factor. So get in line online, right? And so
Yes, that's exactly right. People can get in line online. We actually love it when people access our Next Level Urgent Care app, which is in all of our different, all of the different app platforms.
Mhm.
Essentially, you can log into the app and get in line for the first available walk-in appointment, or you could even schedule an appointment on one of our scheduled lines.
I'm telling you, it's huge, and it's so convenient that you don't have to, wait in in a waiting room, even though your waiting rooms, by the way, are beautiful. Um,
Oh, thank
But
you.
it is nice that you don't have to go wait in a waiting room when you're not feeling well. And so I love it. So today we are talking about all things strep throat. So we're gonna keep it like pretty like concise and clear. And so let's talk about just real quick, what are like the telltale signs of strep throat? Like when do you just know that your kid has strep throat?
Well, the most classic and most well-known sign of strep throat is sore throat. And I think anybody who wakes up with a sore throat in the morning or who develops sore throat over the day immediately is going to wonder, do I have strep? What is going on? It's probably the most well-known pharyngitis out there. And patients can have varying degrees of severity of pain. Okay, it can go from kind of like a mild kind of like burning or raw sensation in the throat to being something really more severe, so much so that you might not even want to eat or drink.
Yeah, I mean, if you've had strep throat, you flat know, like you might be kind of miserable. And so typically, you might present with fever, but what are some like hidden signs of strep throat? Because I know with little ones, they can't always share, but then they can also have some really confusing symptoms that you wouldn't think were strep throat related, but they were.
Right. That's absolutely right. So, again, classically, you're going to have the sore throat, certainly fever or even elevated temperature goes with strep throat. But I don't think that most people would also consider the symptoms of like headache and nausea being classically associated with strep. Those are certainly they're a little bit more subtle. You can have nausea and headache with almost anything. Some of us get headache because there's a lot of sunlight outside. But oftentimes, patients with strep will have like low appetite, almost like anorexia. They just don't even want to eat. There'll be some nausea with it. Some kids are going to vomit because of the presence of strep pharyngitis. And again, that headache just comes from the general malaise of strep altogether. And so it can really paint this syndromic picture. Oftentimes, I'll be honest, there's some patients who come into next level that don't even complain of sore throat. But they'll come in with that headache and with the nausea and with some elevated temperature or fever. And we run a strep on them. Sure enough, there it is. It's positive.
It pops. Now I'll be honest. I am like that kind of mom where I don't love like messing with the flus and stuff where we can't do anything but like really manage the symptoms. We almost want that strep test to pop a little bit because then
Yeah, yeah.
they can get antibiotics for it. And you know, that's just who I am. But how does Next Level specifically test for strep? You just mentioned it. But what do you guys do?
Right. So, I mean, the fastest test is a rapid antigen test. So, we will take a long, like Q-tip swab and scratch kind of the back of your throat where your tonsils are. And a really good medical assistant or nurse might really get in there and get a good specimen. The kids always love that, when
Yeah.
somebody
Oh
really
yeah.
goes for that specimen. But then we will take that and drop it into like a reagent in our lab. It's what we would call a CLIA wave test. So it's a rapid test that can be performed right in the doctor's office. And then we will wait to see if there is a positive line on the test kit. So there's the rapid antigen test, which is very quick and easy. Usually you can have an answer in 5 to 15 minutes on something like that. But then there's also the throat culture, which is, you know, throat culture has been the gold standard of strep diagnosis. But the problem with throat culture is that you have to wait. Generally,
Yeah.
you have to wait for like a day or two for the lab to like receive the specimen, put it on a petri dish, put it in the oven, pull it out, in 12, 24, 48 hours to see if any strep grows. So the culture, although it is very, very sensitive and specific, takes longer than the rapid antigen test. You know what, Megan, on that note, too, I do want to let your audience know the rapid antigen test is not perfect, okay? It'll give us a quick answer, but it can be wrong about 25 to 30% of the time, and doctors know this, okay? We accept that level of wrong in medicine. And so sometimes if we have a patient in front of us who has classic strep symptoms and a strep outbreak, even if that test shows negative, and we know we have a kid with exposure, maybe someone in the house, or definitely another kid in the classroom has it, we might go ahead and treat for strep
Mhm.
because that patient in front of us looks like a strep throat patient.
Strep kid. Yeah.
Mhm.
And I think most moms, like, we would kind of like fight for that too. Would be like, I'm pretty sure.
Yeah, well, right. I mean, I've been there where the mom's like, I don't know about this test y'all are doing. And I actually love to be able to tell moms, you know what? Your spidey senses are probably right. Especially knowing that we have a high false negative rate with that test. There is a new emerging technology, the PCR technology. I think in the next, say, 5 to 10 years is really going to edge out cultures. And so with the PCR technology, what they're able to do, same procedure where you get the throat swab, but instead of putting it on a plate and letting it grow in the petri dish over a couple of days, what they will do is put it into an environment where the DNA of the bacteria is amplified again and again and again and again. We learned a lot about PCR during the COVID pandemic, and the technology there has been really accelerated, so much so that we have these great panels, that we can do for PCR testing that, would help us identify not only strep, but like rhinovirus and RSV and all other kinds of things, COVID, flu, whatever.
Yeah.
And so the PCR technology is amazing. It is accurate and it's also fast. We have a rapid PCR at Next Level that we can run in about 45 minutes. It's called BioFire. It's a panel of about 23 different pathogens that we can discover on that PCR.
Wow.
There are even some more there, like, since the advancement of that one, which I really thought was just like an incredible breakthrough for medical science, we now have rapid PCRs that are CLIA waived, meaning they can just be run right there in the doctor's office. And you can get an answer sometimes in about 15 minutes with some of these rapid PCR CLIA waived options. And so, right now, throat culture is kind of the gold standard for strep, but don't be surprised if, 5, 10 years down the road, no one's even doing the culture anymore because we can get a faster and very accurate answer with the PCR solution.
That's fascinating. And that, I mean, if we can say one good thing came out of pandemic, look at all the excellent research
Yes,
and accelerated testing process. Like we didn't necessarily
yes,
want to have to go there, but here we are. So we'll make the best of it, right?
absolutely.
Yeah.
Science is moving at a really rapid pace. Even like genetic testing, specific testing, targeting our own personal DNA is accelerating at a rapid pace. And strep throat diagnosis is going to be affected in a very positive way because of those advancements.
I think that's awesome. The more information we have, the more moms can help treat it, which by the way, so obviously we get a strep diagnosis and we're probably going to get a prescription for antibiotics. What else can we do over the counter just to make our kids feel better to kind of get through that, 24 to 48 hour hump when, we're waiting for the meds to work.
Right. So I love this question because there are some really excellent things that parents can do to intervene before they get the antibiotic and before the antibiotic really starts working to help our little patients feel better. So the first things that I like to recommend are tried and true Tylenol and ibuprofen. They
Mhm.
work for fever, they work for pain. So I generally tell parents, pick the one that you like the most. I am a fan of equal proportions for both of those therapies. So use the one you like, with full understanding of what your child tolerates best. Some kids have ibuprofen allergy, um, but pick that medicine and take a dose of that medicine maybe like every 6 hours as needed for fever or discomfort. Also, Megan, like to tell parents that if you have selected one of those, Tylenol or ibuprofen, to start with, and you're giving it every 6 hours, but it's just not quite enough to keep that fever away long enough or to keep that pain away long enough, you can actually alternate Tylenol
Mhm.
and ibuprofen about every 3 hours as needed for fever and pain. Okay. So that looks like Tylenol, wait 3 hours, ibuprofen, wait 3 hours, Tylenol, wait 3 hours, ibuprofen, wait 3 hours, back and forth. And usually that's enough to
Mhm.
make our patients comfortable, and get them feeling better, and also to help prevent, pain and fever from re-emerging. So those are always a great place to start.
No, I think that's like a magic thing. I just went through surgery and like the 3 hours. I mean, I was counting down every
I'm
3 hours
telling you, it's
too.
like just
It's
set that
like,
alarm 3 hours on the dot,
yes, ma'am.
it
And
makes a
so
big difference.
it does, and it's so helpful in just kind of curbing that pain so we don't let them get to a crazy level. So let's thinking about that they'll probably get an antibiotic. Some of that can be like kind of tough on a kid's tummy. Are there
Yes.
certain things that you would recommend? Any sort of like probiotics they need? Should we be like eating less or more of one thing or of another?
Right. So I'm glad that you asked. Probiotics, there's a lot being stated in the news about like gut biome and gut health. And yes, for the last several years, the medical community has pretty strongly advocated for some kind of probiotic while our patients are on antibiotics, just to make sure that your good bacteria stay in a nice, healthy level while that antibiotic is running through your system. One of the consequences of taking an antibiotic, I mean, it is getting rid of the pathologic bacteria inside of our throat when we're treated for strep. but man, it can just wipe out all of your healthy bacteria in your gut too. So much so that sometimes people wind up with diarrhea. Sometimes people get an unfortunate overgrowth of a particular diarrhea called Clostridium difficile because of the antibiotics that we're taking to cure us of something else. So yes, I'm a big fan of probiotics. Some people choose to take yogurt. There are commercially available probiotics over the counter. I don't have to call the names, but you see it in the store. They're those really terrible tasting teas that have probiotics in them at the store. If you can tolerate that, do it. You might even mix it up in a little juice cocktail, do it. That's fine. Yogurt. I've seen some that come in like a powder form that you can mix with some water and drink. Those are good also.
Well, I think that's great advice. We want to make sure that we keep all the good stuff like still there.
Yes,
But we're already trying to like get the meds down. So it's like
yes,
it's always a
yeah,
fascinating power play. Like, how much can I
yeah,
bribe you to
yeah.
take this?
Moms have to be incredible negotiators just to get the medicine down, and you want to add some extra probiotics to that. Makes it a little more complicated, but maybe you can make it sweet, with a little bit of juice or something.
That's a great idea.
Yeah, well, for our older kids, let's say kids, 6 or 7 and up, if you have a child who tolerates mints, okay, they can let a candy melt away without being at risk of choking. You might even consider the throat lozenges. I just love those things. Like the over-the-counter chloroseptic.
Yeah.
They don't necessarily have any kind of like lasting anesthetic effect, after the drop has melted completely away. But boy, while you have that drop melting in your mouth, it can be so therapeutic.
Yeah.
So that's another thing that moms and dads could whip out if we need a little bit of help settling down throat in the pain quickly,
I
or
think that's
pain
perfect.
in the throat quickly.
Yeah. There's just something soothing about sucking on,
Yes. Yeah,
lozenge or something like,
yeah.
I'm a big fan of Ludens, even maybe when I don't have a sore throat.
Right, right. Well, or even just a good old-fashioned cough drop. It doesn't
Yeah.
even necessarily have to have that like benzocaine and anesthetic in
Yeah.
it. Really just a traditional cough drop is sometimes very, very soothing to the throat when we're not feeling great. Megan, you look so much younger than me, so I'm not sure if your generation heard of like the warm salt water gargle. Um,
Yeah.
Again, it's not delicious, but I remember going to the school nurse, and sometimes that's all the school nurse had to offer kids who, had sore throat. And so they'd pour like a bunch of salt into a cup and put warm water in and just mix it and have us gargle and spit it out. Some
Yeah.
people find that to be very therapeutic.
Well, I think you're very kind on the age thing. I'm much older than you. Um, but it's funny. So obviously we have all the allergies here. We've talked about that in the past. But my daughter went to the school nurse because she did have a sore throat and she wasn't presenting with fever or anything yet. And they still do the salt and water
I'm
gargle.
saying, you can't fix what's not broken, okay?
Yeah.
Warm salt water, the nurses love it, and I love the nurses. So if they're recommending it, let's try it and see if it helps to provide some relief.
And I mean, I'm here for it. Grandmas were on to something. So
Right, right.
Dr. Traylor, thank you as always for joining us and helping provide super valuable and timely, relevant information to our audience. You're a gem.
Oh, Megan, you're so kind. It's always my pleasure to be with Houston Moms blog. If you guys ever need anything, we are here for you at Next Level. We're open 9 to 9 every day, except for Thanksgiving and Christmas.
I mean, we'll give you the 2 days, okay? We'll give you the two.
Appreciate
Um,
that. Yeah.
I will drop in the comments below links to all of the locations for Next Level Urgent Care, where you can find them around in your area, how you can get the app, which will like save your life. I'm telling you, put it on your phone before you need it. put it on there now, and then, you know, God forbid something happens, you got the app ready to go. They also, Next Level is also doing some really cool things in the research area.
Yes.
So Dr. Traylor had alluded to a few of those kind of, you know, research things that they're doing. I'm going to drop a link there too. So I know they're running a couple different interesting research studies right now, as it relates to sprains and broken bones or something. So I'm going to put
Yes, and
that link,
Alzheimer's disease and atrial fibrillation, all kinds of things.
all the things. And so we might be able to hook you up with Next Level and see if you can be a part of a research study. So we thank you again. And until next time, Houston moms, we will see you later. Have a great day.
Goodbye. Thank you.